I'm going to start off my video by demonstrating the intramuscular injection sites. So here is my lovely patient. I'm going to start off by showing the deltoid site. So just exposing my patient, and then I'm finding the acromion process. And I'm going to take 2 to 3 fingers and kind of go below like that. And then kind of find it like that. Gonna form a little triangle, and then I just kind of pull Z-track, and I'd give my injection right here. Yep, right there. Okay, cool. Next, expose my patient. They would be supine or kind of sitting up. I'm gonna show the vastus lateralis, so the thigh injection. So I'd locate the patient's knee. I'd put about a hand kind of above, and then I'd locate my greater trochanter and put kind of a hand below where it is, so right there. And then basically between my thumbs, right here, is where I'd give my injection. Next, I'm going to show the ventrogluteal site, and to do that, so it's the right side, I'm going to use my left hand. I'm going to place my hand on the greater trochanter, so like right here, and then I'm going to have my index finger pointing towards the anterior superior iliac spine, and then my middle finger pointing towards the iliac crest. I would give my injection site right here. And those are the intramuscular sites. Next I'm going to be demonstrating how I draw up my medication. First thing I'm going to do is I'm going to clean my surface. Well, actually, the first thing I would do is go get all my supplies. But yeah, so I've pulled up my my MAR, and at the Pyxis, I removed the medications that I will need, that I will talk about in a second. But yeah, I'm gonna clean my surface. Wipe. Okay. I've got my MAR here. I would dispose of that. Okay, and so I'm gonna clean my hands really well, and I'm gonna place my gloves on. Verbalized everything. So here, my patient, I have my MAR, and I will be giving or drying up the medications of Humulin regular insulin, and then the medication ketorolac. And according to the MAR, yep, right patient, just gonna check. Yep, and for insulin, I already took the blood glucose, and it ended up being 328, which according to my sliding scale would mean that I need to draw up 10 units of insulin, which I will be giving sub-Q. And then for the ketorolac, according to my MAR, I will be giving 15 milligrams, which equals 1 milliliter, so I will be drawing up 1 milliliter, and that will be given intramuscularly. But yeah, checking right dose, right drug, right route, right patient, and then it's the right time. It's before breakfast, and they need their insulin, and I'm gonna assess their pain. Okay, so first, so I cleaned my hands, I have my gloves on, and I'm going to be cleaning the tops of the vials, checking integrity of them. I'm gonna go ahead and clean. I'd clean each top for about 30 seconds. Whoa, 30 seconds later, okay. 30 seconds later, nice and clean, really scrub. Okay, and then I dispose of that. Okay, first I'm going to draw up the insulin, like I said, 10 units. I have my insulin safety syringe. I'm going to open the package. Okay, and I'm going to draw up 10 milliliters. Yep, 10 milliliters of air, which I'm going to inject into the vial. Gonna safely open the syringe, tilt my vial, bubble up, gonna go in, bloop, and inject the air, invert the vial, and I'm going to be drying up the medication, Okay, cool. And I'm gonna drop a little bit extra because I see a little air bubble. Remove. Flick. Gonna make sure it's exactly 10. Perfect. Okay. And then gonna recap my needle doing the scoop method. Okay, this one is drawn up. And then my Couture lac. Since I will be drawing up a 1 milliliter, I will be using a 3 milliliter syringe. And to drop the medication, I'm going to be using the 18 gauge. Very carefully without contaminating. Put that on there. And then draw up 1 milliliter there. Okay. Just carefully uncap. I'm going to grab my clean vial. Bevelette going in. Injecting air, inverting, drawing up my medication very carefully. Nice. Here we go. Alright. Flick. Air bubbles, making sure it's exactly at 1. Okay. Pretty good. And then I'm gonna scoop method. Scoop. Okay, now I'm not going to be using this because I've just made it and it's way too big. So remove. This goes into the sharps. We're going to say it goes into the sharps. It's in the sharps, okay. And then I'm going to take my 23 gauge without contaminating, opening up my package. Connect. Wonderful. Okay, my medications have been drawn. Disposed of all my supplies, and then I'm going to just label my vials, and in the process just double checking that I did everything correctly. So I have my labels, and my labels have the correct patient name, the correct drug and dose, the time and date it is, and I'm going to sign my labels with my initials and then place them on. Yeah, my medications look correct. I've verified right dose, right route, right drug, right patient, and right time. Wonderful. Okay, so I have my medications. I'm gonna take them with me, as well as my MAR into the patient's room, and also some gauze and hand sanitizer. Okay, cool. Alright, so I'm at the patient's room. I have the medications I need. Knock, knock, knock. Hello. Giving privacy. Hi. My name is Marilyn. I'll be your nurse today. And I'm here to give you your insulin and your Couture lac. Is now a good time?
Yes.
Perfect. Awesome. Alright. Yes, it is here. How are you feeling right now?
I'm having a little bit of pain.
A little bit of pain, okay. I actually have your Couture lac, which is your pain medicine. Can you first give me your name and date of birth? Yep. Awesome. Lewis Street, that's you. Right date of birth. Perfect. Okay, and then your pain. On a scale of 0 to 10, 10 being the worst pain imaginable, how would you rate your pain?
An 8.
An 8? Okay. Yeah, I will be giving you your PRN Couture lac then. First things first, I'm gonna clean my hand. Alright, do you have a preference with which medication I administer first?
Can we do my insulin first?
Yes, of course. And then do you have a preferred site that you like?
I like my abdomen.
Okay, we can do that. Alright, so yeah, clean hands.
Can I check your first and last name?
We're going to
So I'm checking my patient's
put my
first and
gloves
last
on.
name based on the name that I have in the order. Can you state your first and
Alright,
last name?
Lewis, I'm gonna go ahead and expose your abdomen, okay?
So Mr. Reader, today we have insulin and we have Couture lac.
I'm bending over. I'm actually gonna raise
So
the
what's your pain like now?
bed.
You stated that it was 8
Just so it's a little bit more comfortable to give that
Yes, so we'll give you
injection.
the Couture lac for that pain. And the
And sit
insulin
you
will
up
be
just
to
a
help
little
you
bit.
with your blood sugar level. Okay?
Awesome. So I touched
So
things. I
after
wash my
giving the
hands in
medication,
Big Glove
you need to let me
personally,
know if you
so
feel
that's
any
what I would do.
discomfort
And then, okay, I see that you really like to give your injection on your left side. Is it okay if I do it on that right side?
Yes.
Okay, perfect. Yeah, you really want to rotate those injection sites. So to kind of prevent a lot of damage to your tissue, make sure that insulin is received by the body accurately, and to avoid fatty deposits of skin that can form from just going into the same site over and over. So we'll do it here. I'm gonna grab my alcohol wipe. I'm gonna make sure to clean your skin really well. There you go, about 30 seconds. And I'm gonna let that fully dry. Okay, so one more time, just gonna check. Looked like your blood glucose was 328 this morning. That's on the high end, so according to the sliding scale, I will be giving you the 10 units subcutaneously in the abdomen. It's right before breakfast, so now is the correct time. So, yep, just verifying with the MAR. Everything looks good, right?
And let me know if that
Patient, right drug, right route, right time, right dose. Okay, all right. Looks like that's nice and dry. I'm going to carefully uncap.
Okay, so I'm gonna start with your ends.
All right, and then I'm gonna pinch the skin. You're gonna feel a little pinch, I'm sure you know. I'm gonna go in at a 45-degree angle, bubble up. And
thank you. And I'm going to grab my...
all right, wonderful. You did great. I would then dispose in the sharps, but we are using these to practice, so I am going to carefully recap that. But yeah, it's been disposed of. And then I would take the gauze if she were bleeding, or you were bleeding, but no bleeding. Okay, gonna move on. Awesome. You did great. We're almost done. Just one more, okay?
How does that feel?
So, then I would wash my hands, put gloves on again, just personally. Yeah. Next, I'm going to be giving that intramuscular shot, the Torlac. I'm going to make sure I have some gauze ready. Okay. So, yeah. Let's clean that site. Do you have any preference of where you want to get the shot? Your options are your arms, your thumb.
Arm.
Your arm is fine? Okay. You can expose. And again, locate the deltoid muscle, cranial process, 2 to 3 fingers down, be right here. Clean the area really well. Okay. I cleaned it really well. Gonna let that dry. While that dries, gonna check the Torlac. Yep, 1 milliliter. The order is 15 milligrams, which equals 1 milliliter for pain. She vocalized her pain was an 8 out of 10, which fits the order of the doctor. Yeah, for moderate pain, 4 out of 10. Perfect. Q12 hours. It's the correct time. So again, right patient, right drug, right route, right time, right dose. All right, looks like that's nice and dry. I have your medication here. Gonna uncap.
I'm gonna put on my protection.
Perfect. And then the acromial process, 3 fingers down. I'm gonna do the Z-track method. Pull the skin taut, bubble up, and then just kind of dart. Medication. And then release the Z-track and pull straight out. Awesome, wonderful. And then I will take that gauze if they were bleeding. Dispose of my sharps. Again, for training purposes, recap, you never recap a used needle. I would never do that in real life, just for this. Okay, but yeah, that's nice and dry, it's not bleeding. Awesome. Alright, Lewis, remove my gloves, dispose, clean my hands, my needles have been cleansed, my area is nice and clean. Okay, That is it as far as your medication. That medication for pain, I will let you know, it acts pretty quickly, about 10 to 15 minutes. So I will go ahead and come back then just to check in on you. And then, but yeah, I have your call light here. Please call if you just need anything, or if you're feeling uncomfortable or uneasy, anxious, or just anything, just don't hesitate to call. Do you need to go to the bathroom at all?
No.
Your possessions, your call light, your position, are you comfortable?
Yes.
Okay. I'm going to bring you down your breakfast. The CNA should come and bring that to you pretty soon. But again, I'll check in and make sure you get your breakfast.
Thank you.
Yeah. Awesome. All right. Everything's nice and clean. Nice hygiene. I'm going to go document that since there's no computer. Okay.